Located in southern Africa, Malawi is a landlocked country sharing its borders with Mozambique, Zambia, and Tanzania. Poverty and unemployment remain high in the country. Many young girls and women turn to sex work to support themselves and their families. While Malawi has made huge strides in fighting the HIV and AIDS pandemic, sex workers remain extremely exposed to the disease. Key populations, including female sex workers, have lower access to health information and healthcare services than others in the community. Sex workers are over 5 times more likely to contract HIV. They also face much higher risks of unwanted pregnancies and sexually transmitted infections, STIs. Globally, 29.8 million people are receiving antiretroviral treatment, ART, with several countries on track to reach the 95-95-95 targets. Despite this progress, certain populations are being left behind. Key populations, including men who have sex with men, sex workers, and transgender people, struggle to access medical and sexual reproductive health services. With funding from the Global Fund through World Vision and Christian Aid, FIPAM is implementing an HIV prevention project targeting female sex workers in Dowa, Dedza, Kasungu, Karonga, Mchinji, Nchewu, and Salima districts. The project seeks to reduce new HIV infections among female sex workers. This will contribute towards the elimination of new HIV infections by 2030 and reduce HIV-related morbidity and mortality among female sex workers in the targeted project sites. Joyce Banda, a female sex worker in Salima, testified that the project has increased the number of sex workers accessing HIV prevention, care, and sexual gender-based violence support services.
FIPAM itabwera kugwira nafe ntchito ma sex workers. Pamene ifeyo ma sex workers tinapeza ufulu ndi maudindo. Pamene poyamba apo sitimadziwa china chilichonse.
FIPAM project coordinator Saukira Sitima says the clinics have proved to be a vehicle that links sex workers to services.
Female sex workers avoid going to the public facilities is because they don't want to be seen around at the public facility. That's why we take these services right to their hotspots.
Stephen Nyirenda, a service provider, says the Moonlight clinics are easy for sex workers to easily access services.
Where we reach out to the female sex workers, providing them with services like HIV testing and counseling, provision of family planning services methods. Basically, we do provide these services every month, and it depends with the hotspots. Sometimes we reach out to up to 20 female sex workers per hotspot. Some other hotspots can reach out to even 30-40 female sex workers.
Clinical officer at Nchewu District Health Office, Frederick Monjeza, also concurs with Nyirenda.
So during daytime is their time to sleep.
Community Policing and Victim Support Unit Coordinator Inspector Wile Bunya says the police in Nchewu have been receiving many cases of sexual abuse among female sex workers. He says because of the project, many female sex workers now know their rights.
We have been receiving cases of gender-based violence whereby perpetrators are their customers.
Female sex workers can now afford a smile as they are now doing their business with easy access to health services and are now healthy. They are only hopeful that organizations such as FIPAM will continue supporting them.